Hey guys, welcome on in to Medical Talk in Layman's Terms with Nurse Charlene. And tonight, because of a special request and a situation where just too many people were having trouble with it, the topic tonight is respiratory issues. Not the whole Rolodex of respiratory, but respiratory issues. And so I decided tonight that that's where we'll bring it and stuff. I want to put the comments on the screen. So let's see. Y'all come on in and support me by just getting on with me and stuff. If you have a comment, experience, I love those and stuff because I use them as like testimonials and stuff. And once you're on and you get to getting comfortable and everything, then others will come on, or they may not ever come on and stuff, but they'll be able to see the information, and they might be suffering with the same thing as you because guess what? Everybody got a respiratory system, even pets and other little animals and different things and stuff like that. So we all got to breathe at the end of the day and stuff. So welcome on in. And the topic tonight is respiratory issues. I'm just going to go over some good points with you and a couple different things and stuff like that. And y'all come on in and stuff. It's time to come on in and stuff. I'm getting everything ready and stuff. So I'm getting my mama ready and stuff. She be like, put me on. And then she turned up the phone real loud so that we can when I put her on and stuff, everybody can hear what she can hear and stuff like that. But yes, so I got her hooked up and everything. Excuse me. Okay, so we good. Okay, so welcome on in and stuff. So before I get started, look at all that stuff on the board behind me. I know. Charlene, you could draw so well. You know what? I'm trying. I'm trying. Okay, I can't, but I'm getting to the good part. You can make out most of the stuff, but guess what? I got my little trusty Mike and Ike pointer, and I'm gonna point to it tonight and tell you what it is. I just made this up just a few minutes ago and everything and stuff. So welcome on in, y'all and stuff. I'm just happy to be on and to be able to do what I do best, and that's give you informational, educational type things and stuff, and in exchange for that, you take some of this and you keep it in your Rolodex up here and stuff like that, so that you can understand. Welcome on in, Auntie Josie and stuff. Good to see you. Thanks for joining. And I welcome you guys in and stuff. And if you got a comment as I go along, and stuff, you put it up there and stuff. Give me a minute, and I'll definitely get right to the good part and stuff and answer your questions, most of them. If it's something I'm not sure of, I got to do you that service. And that means that I need to let you know that I'll answer it after the live is over with. That's the only difference. But I definitely go to the end, and stuff when everything is over and stuff. And I answer your questions and stuff, no matter what it is and stuff. So nothing's too big or too little and stuff. But I'll let you know if I can't answer it or I'm not sure. I don't want to give you false information. So let me go ahead and do what I do best. And that's research. Deep seek. Yeah, deep seek. Okay. So now we get into the good part. So I'm going to read my podcast disclaimer so that I can continue to be on here giving you something without violating me or you. All right. The podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. You got to do that. I do that. If you have questions about a medical condition, reach out to a qualified healthcare professional. Your doctor. That's the qualified healthcare professional because they know your history. Okay. Never disregard professional medical advice or delay seeking it because of something you heard on this podcast or any other one. Come on, we got to use our common sense. And that's even for me. There's so much information out there. How do you know which is good and which is bad? You got to do some of the research on your own. But it's okay to pick up what they're saying and everything. So, guest views are their own and may not reflect the views of the host or this podcast, Medical Talk. And then also, the information shared is for general knowledge. Okay. It should not be used for any legal or medical purposes. Meaning, don't be putting me in your lawsuit. I'm not going to testify. No, I'm just playing. And so don't be putting me in there. What was that thing behind me? Player hater. Okay. And then also always consult with a licensed professional who knows your medical history for a meaningful evaluation. So if you want to get to the good part, consult your doctor, because the doctor is going to know your medical history or whatever you gave them so far more than anybody else, more than even me, and stuff. I don't know your medical history. I can tell you the wrong things. So that's why I said this is for general knowledge and educational purposes. And stay informed. So you're right in doing that, and you're staying informed by just getting on here. So you are already past that part. But always seek professional medical advice when it comes to your health. Always seek and go to the professional, which is your doctor. I can't say enough about your doctor, your doctor, your doctor. And if you don't have a doctor, get one. We got to get one and stuff. You can't be the ruler of your own body. And there is a doctor that's over all doctors and stuff, and that's God. But even God said, be wise, and everything and stuff. So you do have to seek the advice of your doctor and everything. I didn't say not to pray. You can pray first and pray for the doctor that he give you the right information. But you got to go to that doctor, because that's what they went to school for. And they don't know everything. But if you give them enough information, they will get you to the good side. That's what I call it, recovery. Okay. So welcome on in, you guys, and stuff, to Medical Talk in Layman's Terms with Nurse Charlene. The topic tonight is respiratory issues versus illnesses, because I'm going to be talking about both and everything. So it's in that same little category and everything. So I think I want to do this real quick and stuff so that you know what's on the board behind my head, where these little boogers is all behind my head, but I'll show you. So we're going to go up to the top. Everybody knows what that is, right? Tissue. And I'll try to make me a little tissue box, one of those little Kleenex boxes or whatever and stuff like that. And so then another thing is, because we're talking about the respiratory system, there's medicines and stuff like that, and treatments and stuff. So that's like one of the little funny medicines and stuff. And I got props, you guys, tonight. Bam! Woo-hoo. Bam! So we're going to be getting down tonight. We got some fun little treats for you. But in the meantime, that's one that I drew on there, like a Advair type thing and stuff, if anybody's familiar with any respiratory problems. There's another Flonase. That's the one you scoot up in your nostril, and you squirt this little stuff up in there, and it does what it does and stuff. Then there's pills. Sometimes they give you a steroid to help, get to the good side of breathing again and stuff like that. It could be all types of pills. It could be Claritin, or what is it, Zyrtec, Allegra. Y'all hear this? I'm advertising you. Give me a commercial or something. But that's what those, pill bottle represents and stuff like that. And then, of course, that's an inhaler, like a albuterol or something like that. And then this little puppy right here is a nebulizer. A lot of people sleep on it unless you've been diagnosed with asthma. You probably wouldn't know what this one was and stuff. But a nebulizer is an oxygen concentrator. And what it does is, this is the little cord. See, I'm getting there, but it's going to get better and better. Y'all just keep on sticking in there and tuning in with me and stuff. This is a mask. That's what I was trying to make, a mask to go to the concentrator. And that's the little rubber thing to go around your head and stuff like that. And that's so that when you turn that on, you put this little medicine inside of it. But I got that too. Look, because Charlene loves you, baby. That is the machine. Look at that. And you put the little juice in here and you put this on and you breathe it in and it gives you a little smoke. It's not smoke like fire smoke. It's the mist of the treatment. And it actually, you breathe it in and you take deep breaths and it goes all the way down into the good part, which is your lungs, and opens them up because they're closing off and then you can't breathe. And then could you imagine that, trying to suck air through a straw and it's kinked? It's terrible. It's terrible. Good evening, Miss Sandra. Good to see you on. Thank you for joining. Yes, yes. Come on in. All right. And so that was the nebulizer machine and the mask and everything and stuff. And then I just put COPD. And then this says 6 feet. I'll tell you what that means later. And then we got for like maybe adolescent, and teens and stuff like that, if they've had asthma and stuff. This thing is, I did a special job at it, but I was trying, and stuff. One side is where you suck it in and stuff, and this side is where you put like one of those albuterols on there and you spray it in. And this is so you get the real dose, because some kids don't know how to do that, but they know how to puff this in and stuff, which is a spacer. And the chamber fills up, the chamber, and it fills up. It's like a round tube, and it fills up with the medicine. And then that's to ensure that your child breathes it in, and stuff like that. And it breathes in also, allows the child to breathe it all in. And when that space is clear, they can puff again, or they're done. They get their 2 puffs and they're done. And that will open up the child's lungs and stuff so that they can breathe. That's scary. That's like putting a pillow over your head and you can't get air and stuff. Putting a plastic bag over your head, you suck all the air out, and then what do you do? Yeah, it's a panic. That's why asthma is so bad and stuff. So I'm gonna scoop my head over to the side so y'all can see. I put the noses. These are noses, you guys. I put 2 on the side panel and then 1 straight up with 2 nostrils right there. So this one, that's just a drip, 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 and a green snot or something like that and stuff. But that's what it does. If you just don't blow your nose and you just let it drip on down, that's what it's doing. It's just leaving a little pile somewhere, maybe on your shirt. And then this one, the same thing. It's a little more of I call it like a snail. It's boogers. All of them is booger, 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 and stuff like that. And that's what that one is. So I made this one red to just give you a little spice, and that's because this one right here is blood. And it's because once you have those little things, the little prawns in your nose and stuff for oxygen and stuff, if you don't use this thing called a humidifier on that oxygen, and you're day in and day out constantly using oxygen, your nose can dry out, and then it starts to give you little crunchy red boogers, which is bloody boogers, because your nose is so dried out. The mucous membranes inside your nose, they need to be moist at all times and stuff like that. And when they dry out, because you're constantly getting air in there, that's where that happens. So you see where we get into the good part. I just want to do things that you guys can understand so that you see where this all comes from. Then you got your x-ray. These are tests. So an x-ray is sometimes what they'll do to test you. Even for COVID, they did an x-ray on me first, and stuff when I had caught COVID and stuff like that. There's also blood tests that they can do. One is called arterial blood gas. That's where they go inside your wrist into your artery. It hurts like the dickens, but it can tell them certain things about how much air exchange you're doing and stuff like that. So it's very important. And then, like I told you about the breathing treatments, that's where this one comes in right here, which is a nebulizer. So you see where all of this is kind of tying in and stuff like that. And I just want to get what's on the board together so that you understand. So Sandra, you said I remember when you made something similar when we did COVID. Absolutely, absolutely. And it came out, if I'm not mistaken, yes, yes, and stuff. So definitely all this stuff, it ties into that because I need to do COVID by itself though, but definitely this all ties into what's happening with us in general and stuff, because if you got lungs and a respiratory system, you're gonna have some issues sooner or later, not all the time, and that's why we're well sometimes and stuff. But over here, I just did a quick anatomy, and I didn't do like the super job, but it kind of looks like what it would look like, to the doctors and stuff like that. So you got a person and their head and all of that stuff. They got a nose, they got a mouth, they got a trachea, and I'll be getting to that soon and stuff. They got lungs, two lungs. Good evening, Pastor Mayfield. Welcome on in and stuff. You know what to do. We're talking about respiratory issues versus illnesses and stuff. So anything respiratory, and we've all had those problems. Even if it was the common cold, we don't like them and stuff. So definitely that. So I'm just talking about the anatomy and stuff. You got a nose, you got a mouth. Sometimes if your nose is stopped up, guess what? You breathe through your mouth to bring the air in. So could you imagine that? You're breathing through your mouth to bring the air in and out and stuff like that, which means that if this is not working, the other one is working, and stuff like that. And if they both ain't working, you better be at the hospital. Yeah. Okay. And so, oh yes, Pastor Mayfield said, great. Yeah, we talking about the respiratory system. We all got this one, and we all guilty of having something, not guilty. It's just life and stuff. So this one, I did this one because we're going to talk about this a little bit later and stuff. I called it this. It's not called that. I don't know what it's called. But anyway, it's a cough, but it's called the cough spray. Meaning, remember I said that I was going to get to why I put 6 feet right here. You probably can't see it because you could see my little light rings and stuff there. But it says 6 feet. It was just a reminder of why I said cough, and then all those little dots, that's they when they cough. Okay, I put my hand over my mouth because it's an instinct. Everybody don't do that. So guess what? They cough down that aisle and you at Walmart with them, and then you're gonna walk right into it. It's gonna go in your mouth. Yeah, it's delicious. No, it ain't delicious, but you know what I'm talking about. Okay, so I'm gonna tell you about that in a minute and stuff. Pastor Mayfield said, I deal with some mild breathing concerns. Absolutely. Now we all do, because I was free of any asthma type things, bronchitis. Now I had the common cold like anybody else, flu. I even had pneumonia at one time, and I found out with pneumonia, it scars your lungs just like a stroke or a heart attack. It scars your lungs in that spot forever. So it lets you know, I've been here. It leaves that Freddy Krueger scratch across your lungs, like COVID. If you've ever had COVID, and even if you didn't know you had COVID and you had COVID, it's leaving a scar. If you've ever had a stroke, it's going to leave a scar on your brain. You have a heart attack, it's going to leave a scar on your heart in that area, if that makes sense. It's that bad. And guess what pneumonia is? It's a respiratory issue. It's a lung issue. Okay. So welcome on in, y'all, to Medical Talk in Layman's Terms with Nurse Charlene. The topic tonight is respiratory issues. Yes, yes, Pastor Mayfield. Wow. It's very special. But I learned so much just researching it before I come to you with these things so that you get the good stuff. But guess who taking it inside their brain too? Me. and I can teach on it 5 different times, and it will be too much information. That's how special respiratory, just the respiratory system is. So I'm going to read you the definition. A respiratory illness is any disease or condition that affects the respiratory system. That's all of them, no matter what it is. If it stopped up your nose, it was a respiratory issue of some sort and stuff. The organs responsible, it is the respiratory system is the organs responsible for gas exchange. That means taking in oxygen, O2 or oxygen, and releasing carbon dioxide. Carbon dioxide is the trash for our bodies. Like poop is the trash for our GI system. We eat and then we poop, and the poop is the waste product. Okay, got you. Turn up the volume and stuff. The waste product is poop. The waste product of when we take in our water or juice or whatever and stuff, the waste product is urine. The kidneys clean the blood, and the blood and the kidneys send out the trash that was in your blood as urine. And so that's the trash of the urinary system is urine. The trash of the gastrointestinal system is poo poo. The gas of the lungs and oxygen is carbon dioxide and stuff. You see what I'm saying? So we don't want carbon dioxide, because guess what it'll do? If we don't release carbon dioxide, we will die. Period. It doesn't matter if you're a nurse, a doctor, a lawyer, whatever, you die. You could be a star, you can be whatever you want to be, you're gonna die. Yes, Josie said you had a scar when you was diagnosed with sarcoma. Yeah, that was another one. And I looked that up, by the way, Josie. I looked it up just so I could get a little bit more information. And I forgot to, but I'm going to give you some information in the comments after everything is over with. But yes, I mean, you already know. That's why but it's good to let other people know what that is, because it's more common than not. It is absolutely more common than not, Josie, and stuff. So I said the carbon dioxide, that's the trash for the lungs, the waste product and stuff. The respiratory system consists of the nose, the mouth, the throat, the windpipe we call the trachea. Remember the people that get one of those things in their throat and stuff is a tracheotomy, a tracheostomy. I'm sorry, not otomy and stuff, but the tracheostomy, and that goes in their throat to help them breathe. It's a breathing tube and stuff. Then it's the bronchi. That's a part of the lung, the actual lungs. So that's getting all fancy, but I did need to put it in there. And then your lungs. Your lungs are, I got a little pen right there. And you get two of them. Now, one might go bad and you can live with one, but it's just never the same. So you want two, and you want two fresh ones. Or you want to get to the good part, if you have damaged them, from whatever life, we're not here to judge, we're here to help, and stuff like that. But whatever life has given you and stuff like that, if your lungs get messed up, which all of ours are, I think, right about now and stuff, in some type of way, even if it's slight, because they told me on my lungs when I caught COVID, I had a ground glass appearance. And I found out, hey, Rosie, Granny Allen, welcome on in to, you said I'm late, but I'm watching in Jesus' name. You was already watching, or you can hear me. She in the house with me. Okay. But anyway, it's okay. Welcome on in. As whatever time you come in, you're always welcome. Yes. And stuff. So going back to ground glass appearance on my lungs, and I was like, well, get it out. And stuff. It was like, it was kind of explained to me like it was a effervescent kind of look on the CT scan where it kind of lit up in a spray, like if you opened up a fresh can of Coke and that little bubble smoke come up. That's what was on both of my lungs, and I was like, "Well, get it out! Like, how I get in there? You know, like what the heck wrong with y'all? I'm gonna beat somebody up." But anyway, and stuff. I digress. I'm saying I'm a patient too. I'm a nurse, but I'm a patient. I got to be a patient too. I'm a human being and stuff. So I'm saying all of this to say that when they said that, I was like, wow. And guess what? I get to keep it for the rest of my life like a trophy because I want to be reminded all the time that I got that on my lungs. Yeah, I went through all this stuff, 21 years and as a registered nurse. Just 21 years as a registered nurse and stuff. I've been other things and stuff for 30 something years now and stuff. But I'm saying all of that to say that I bypassed all those things and got COVID, and stuff. However that happened, okay, it's over. But what I'm trying to say, no, COVID is not over, but it's over for me, that part and stuff, and the whole shock factor and all of that stuff. But I'm saying that to say that anybody can get it at any time, and that's something you got to learn how to survive with it, and you better tell on it. I'm gonna tell you that now and stuff. So then after that, the simple anatomy of the respiratory system. So then I want to give you a couple more little definitions because this is going to help you, and it's very lightweight and stuff. So it's not going to be heavy in the deviation of the septum and all this fancy stuff. We don't have to do all of that and stuff. I just want to say that the nose and mouth, they are entry points for air. Remember, I said if your nose gets stopped up, you start mouth breathing. If you're drinking something, you can't breathe at the same time you're drinking something, so your nose is open to breathe, while you're drinking or eating or whatever and stuff. So either way, they're the entry points for air exchange. They filter and warm it, and stuff before it goes down into your lungs and everything. That's oxygen, the good stuff. And then your throat or pharynx is a passageway for air and food. So in the back of your throat is your pharynx and also your larynx, which is your voice box. Pastor Mayfield would know about that because she sings, and stuff like that. So I sing too. Yeah, I don't sing as good as Pastor Mayfield, but I'll be singing and stuff like that. And long story short, that would be your voice box is your larynx. They're all back there. So you got two tubes. And I was trying to think of it like, I don't know if anybody's ever looked in the back of their toilet. And when you flush the toilet, this thing comes up and this flapper comes up. And then all the water pours down in there and it flushes the toilet. And then that flapper, when it's all done and all the water is gone, it goes boop right back down and it plunges over there. And then the toilet in the back of the toilet fills up, right? And that's how it's supposed to do, or it would just run, and stuff like that. So it got to flap down, bloop, and stuff. You got a flapper in the back of your throat. And so guess what it does? It got two jobs. The flapper, when you're breathing, the flapper opens up over your trachea or your windpipe. Yeah, windpipe. I'm gonna use windpipe because that makes sense. Breath pipe, windpipe, or whatever and stuff. And it opens up and it lets all that good oxygen in. And then bloop, it closes. They don't want nothing else in it. Please, just oxygen, y'all, and stuff. You know what I'm saying and stuff. So then you eat. It got to go back there too. Guess what it does? It keeps the windpipe secure, the breath pipe secure, and it opens up and lets your food drop into your esophagus, which is your food pipe. And that esophagus drops it into your stomach. But it don't drop air into your stomach. It drops the food in there and stuff. Welcome on in, Auntie Darlene. Yes. And I know you are expert and stuff. I should have reached out to you so I could have had you online with me and everything and stuff. But it's okay. Just listen to your niece and stuff. We on here getting on down. We're talking about the respiratory system. Just basic issues though and stuff. But yes. And stuff. So I said that little flapper, It opens for the wind, and goes, the air, oxygen, and going down into your lungs. And then it closes off to protect it, because if food get over there, that's when you choke halfway to death and stuff. So it closes it to protect it, and it opens up for food and drink to go in, and that goes down into a different pipe that runs along the same windpipe area and stuff like that. But that one drops it into your food. So you see where I'm getting at this? This is fancy, but it's really the truth, and stuff. This is how your body works. It's amazing and stuff. So when I'm saying all of that, I'm saying that that's what these things do. So then, what else do we have? You have two main branches. Your bronchi are two main branches. They go to the left lung and the right lung, most of the time or something. That's what they're supposed to do. And that the windpipe enters the lungs that way and stuff via those bronchi and stuff. And so your lungs, and so I pointed those out, that your lungs are right here. You got one on this side and one on that side. Everybody's are at different levels, but they're there and stuff. So then you have your lungs are where everything exchanges. They call it gas, but it's oxygen and carbon dioxide, and then anything else that tries to go down in there and stuff. That's where the exchange goes. Your lungs is literally only interested in getting the oxygen, and it's only interested in expelling the trash they call carbon dioxide. It don't want to do nothing else. It's like, don't let me work that hard. Don't put no food in here. Don't put no liquids in here. But that's when I say I just choked to death, and stuff. That's what that's about and stuff, because there's not supposed to be unusual liquids in there. They got its own mucus and hydration in there and stuff. It don't need no extra help, no extra water. It's not a plant, and stuff like that. So it don't want nothing in here. Give it its oxygen and it'll do what it got to do, and stuff, basically. So that's what I'm trying to say about your respiratory system and stuff. So there's some what I want to go to is the top common respiratory illnesses. So instead of, because it just goes on and on and on and on, instead of giving you all of that, I just want to give you the top common respiratory illnesses. So I can't go into all the other stuff because it would take too much of the time, and we don't have enough time to get all the way into the nitty gritty, but we're going to get to the basic parts and stuff. And this is for, it doesn't matter, anybody that got lungs. So that little baby, that little toddler, that little 7, 8 year old, that teenager, 15, 16, 17 year old, that young adult, 21, 22, 23 year old, the older adult, your 30s, your 40s, your 50s. Guess what? Y'all got lungs, and y'all all gonna get a cold or something, unless you just amazing and perfect like that. But anyway, and so everybody gonna have some issues, something. So the top ones that they came up with, at least for us in the United States, is asthma. And then they got one called COPD. I know you heard of that, but you don't know what it is exactly. It stands for, even if you don't understand it and stuff, this is what it stands for: chronic obstructive. That means to obstruct, to get in the way. Pulmonary is your lungs. Disease is a disease and stuff. So that's what that stands for, COPD and stuff. I'll talk about it more in a second. So then another one is pneumonia. And I told you about that. I had pneumonia before. It leaves a scar, just like anything else and stuff that traumatizes a part of your body and stuff. Then you got the one that a lot of people sleep on, because you get a TB time test. You wonder why they put that little juice in your arm and stuff. I swear up and down they try to give me TB and stuff, because they'll put that little juice. They don't give you TB. If you got it, it'll show. If you don't got it, it'll never become positive for TB. But it's called tuberculosis. That's what TB means, tuberculosis. I don't know if you need to know what all that is and stuff, but that's what it's called, tuberculosis or TB. Let's leave it at TB And then we got acute bronchitis and stuff. So those are the five that I'll be talking about. But if anybody got stories, definitely we'll get into it. Rosetta Granny Allen said, all information is very good. Teach, nurse, teach. Okay. Yes, ma'am. I will teach. All right. So then we got I call it causes and risk factors. And so just breaking down the five that I said and stuff, instead of trying to get all of them in there and stuff, is one is asthma. Some of the common causes of asthma is allergens. So allergens, it doesn't mean allergies. Like, I need some Claritin, I need some Allegra, some Zyrtec or something like that. Allergens is things that you are allergic to. You might not find out until you freak around and find out. But anyway, that would be if you're allergic to a friend of mine, don't be mad, girl. But anyways, said she was allergic to cilantro. So a lot of people, the reason why Benadryl is so prevalent is because she said her lips start swelling up. She said, did the food have cilantro in it and stuff? And then we start seeing her lips kind of bubbling up and stuff. So that was just one right there. But if it bubbled on her lips on the outside, what is it doing in the inside? So if she did get that cilantro and it did cause a reaction, it caused a allergic reaction. So guess what? The first thing they tell you is take some Benadryl while you still can swallow and stuff, because if you don't get that antihistamine type thing like a Benadryl inside of you, then your histamines start going crazy and you start itching and you start swelling, and it could swell your throat shut, making it a life or death situation and stuff. So that's how allergies do and stuff. So they're not just because I'm allergic to that. If you don't like a banana, it don't necessarily just don't eat the banana, and stuff. You don't have to say you're allergic to it, because there's a sensitivity, like being lactose intolerant. I can't eat ice cream, I'm allergic. No, you're not allergic. Your body rejects it because maybe the cow's milk or something, you might have an allergy to it and or a sensitivity to it, not because you're just allergic. When it starts closing up your throat, swelling you up like the nutty professor, then there's a anaphylaxis, and stuff. And that's the worst allergy you can get. And even with that, they'll give you a Benadryl drip, where they stick Benadryl in an IV and feed it to you and stuff. Like, it gets serious. And then they got other items that you can take and stuff, to get to the good part of having an allergy. But that's what asthma, some of the common causes is allergies of some sort, allergic reaction, but also exercise, working too hard, and and yeah, and stuff that can trigger a allergy attack. I mean, a asthma attack. Listen to me, allergy attack. What is an allergy attack? But it'll trigger an asthma attack. And the risk factors for you is genetics. So it might be a family gene that causes you to have asthma running through your family, or pollution. The air is dirty. It's real dirty. We got all this stuff. Okay. So Rosetta Granny Allen said, "Yep, it's telling on you." Help, help, help. All right, Miss Allen. All right, and then Java Lewis says, "Sending love from Raina and I." I send my love right back, y'all, and stuff. Thanks for tuning in, even if it's only for a moment and stuff. Get this stuff and watch the replay if you can't stay for the whole thing and stuff. Watch the replay. We talking about respiratory illnesses and issues and everything. All right, welcome on in, y'all. We getting on down and stuff. So then we got COPD, or chronic obstructive pulmonary disease, and the common causes. It just got one: smoking. So this is nothing, like I said, this is a judgment-free platform. I don't play that mess and everything and stuff, but it said actual cigarette smoke, and it's over time and everything. I want to address this. Auntie Josie said, I am allergic to Benadryl. Absolutely. So I found out about that. Josie, it's another medicine. It's called Atarax. When you're allergic to Benadryl, they got other Benadryl type medicines that you could take that could save your life if you're having an allergic reaction. And if you can't take Benadryl, it's either sensitivity or it makes it worse and stuff. They got other kinds. So yes, thank you for bringing that up because there is other medicine besides Benadryl, just Benadryl and stuff like that that will do the same thing as a Benadryl, but it won't cause the allergic reaction. So some people, if they can't take this, they got to take that and stuff. So that was a good point, and thank you. Going back to the COPD, they said the common cause is smoking, and the risk factors is your age because you know kids are starting. I say kids because they're starting at 8 to 10, 12. They think that they're stressed out, you know, and they might be in a certain, you know, in a certain aspect and stuff, but they think that they're stressed out like an adult. So they're smoking like they see their mom or dad doing, you know, and stuff. Oh, I got to get me a joint, or I got to get me, you know, I got to roll me up one, you know, or something like that, or I need my cigarettes because I got to get to, you know, and stuff. That's what they did for stress. It's called ineffective coping. Even if I was smoking the cigarette and stuff, it's still ineffective coping and stuff. And so that's one of the main things is age. How long you've been smoking will depend on how bad your COPD could get, and exposure to irritants, constant exposure, like all the pollution in the air and stuff, the refineries and stuff like that burning up and all of that stuff, and they leave a imprint on the air and stuff and mess us up like the mobile gas and stuff like that polluting the sea and tearing up all the fish and everything, and so we can't eat that, you know. See, all this stuff is a big giant circle of life or death or all of that in between. Then you got pneumonia, and the common causes is either it's a bacterial infection or it's a viral infection, but either way you got pneumonia. That's a lung infection, and it's either caused by a virus or it's caused by a bacterial infection of some sort. And the risk factors is if you have a weakened immunity, if you already have respiratory problems, if you already have other problems, you know, and then you get pneumonia and stuff, it's because it was opportunistic. It picked a time when you down. You gonna attack me while I'm already down? You know what I'm saying and stuff. That type of thing. That's what pneumonia does. It attacks you while you're down. So that's why a lot of us caught COVID and then pneumonia on top of it, you know, and stuff. Or I did and stuff. You talking to somebody that lived it. So I'm gonna call myself a professional because I'm a nurse and I did it. And the crazy part with COVID is I had the CDC follow me, a public health follow me, the employee health follow me, and my primary care physician follow me, and their COVID program that they launched follow me. Yeah. And I was like, yeah, but why did I get it so bad? Why I'm allergic to it? I was mad, you know, and stuff like that. But okay, I'm here. So I guess I made it. And stuff. So then now we're going to TB, tuberculosis. Nobody cares about what that means, tuberculosis. But anyway, it's caused by a Mycobacterium, whatever. Yeah, it don't matter to you guys. So, but that's what it is. Macro, mac, mycobacterium, mycobacterium and stuff. That's what that's called. The cause of tuberculosis, TB is. And the risk factors is if you already have HIV, you're more susceptible to if you go in public of catching TB from somebody. And crowded living situations like single room occupancy and everybody is out doing what they want to do and stuff like that. you can get a TB outbreak that way and stuff like that. So that's why a lot of places test, because they need to know where it's at and where is it flowing from. And then at my job and stuff, in the hospital or any hospital setting, they make us get TB because it passes around, it'll just wipe out a whole unit, of patients and all the staff. And you got to have 24-hour staff. So even if they work 12 hours, you still need two nurses, and stuff like that for different shifts and all of that stuff. And that runs into a nightmare and stuff. But that's where all that stuff comes from. Welcome on in to Medical Talk in Layman's Terms with Nurse Charlene. The topic is respiratory issues and illnesses. I didn't put illnesses on there, but that's what we're talking about and stuff. So I want to give you some symptoms of the 5 top ones that I was talking about and stuff. And asthma would be wheezing, shortness of breath, and chest tightness. That is uncomfortable. It's no other way to explain that. That is uncomfortable. When you are starving for air, you can't breathe in beautiful air. Oh my God. Like, that is so uncomfortable. Anybody, I salute you that have asthma or respiratory problems and stuff, because it's hard. But don't panic. Find ways to get as much oxygen as you can. Oh my God. And stuff. Pastor Mayfield said, this is really good. Well, thank you very much, because it's really happening right now to this very moment. And then Auntie Darlene said, I know what COPD is. I had a lung transplant, only have one working lung. Oh my God, you did. I remember hearing about it and everything and stuff. And I hope you're to the better side of it and everything. But yes, you would be one that firsthand experience with dealing with that starvation of oxygen. So you want more and more. You want them to blow up the one lung, and stuff like that, because you need it in there and stuff like that. That has to be hard. But I know you're a soldier. I know that much, and I know that you got this. And I pray for you and stuff. I'm gonna tell you that you got people that you don't even know that sit there and say them prayers. All of you guys actually and stuff. But I'm saying all of that to say that wow and stuff. But this is what we need. And thank you for sharing that, Auntie. And then Pastor Mayfield said, cold air really triggers. Yes, it's either cold or really hot and humid, and not humid in a good way and stuff. Hot, sweaty situations, closed in areas and stuff. They both do the same thing. It's like having really high blood pressure, and that's a problem, or really low blood pressure, and that's a problem, and stuff. You got to be in between and fighting for the good part, and stuff like that. And so it's with asthma and stuff like that. It's either really cold conditions, you can't breathe. Really hot conditions and hot and stuffy conditions, you can't breathe. So where's the good part? You see what I'm saying? So okay. And so that's what that part is and stuff. And then there's chronic obstructive pulmonary disease, which is COPD. And that one is a chronic cough. You can't stop coughing to almost save your life sometimes and stuff. And then there's a lot of mucus. And guess what you got to do, because it's overproducing the mucus, so it's all wet and rattly in there and stuff. But you got to try to find a way to cough that up. And sometimes it'll stay in there no matter what you do, no matter how much tea you drink, or warm tea should break it up. No, it's just a matter of the right vitamins. And there is a tea that helps lungs, but it's not the full answer. You got to expectorate or spit up that's in the back of your throat and stuff, and you'll always hear it and stuff. It's a rattle that's just special. And then also it give you fatigue because you starving for air. So I don't have no energy to do nothing because I can't breathe. And okay, but you see what I'm saying? It's literally that and stuff. So that when I do that and stuff, and I go into that other girl and stuff, the other girl, that girl is the one that's snitching. That's the one that's telling on it. That's the one. You see what I'm saying? So that's why I do that role playing and stuff, and I just come up with scenarios just so that you understand. I'm trying to be real as I can with it, so that you get to the good part and stuff. So then there's TB or tuberculosis. Pastor Mayfield said, I was told raw honey helps lubricate your throat where it helps the coughing. Yes. How you know that? No, I know you know that. But anyway, yes, it does help and stuff. Is honey is uh close as we could get to a natural decongestion type thing and stuff where it helps lubricate where you cough at in your throat and stuff, and kind of takes down some of that inflammation and stuff, and in exchange kind of soothing the cough so that it's not so bad and stuff. So I've saw people just take raw honey and stuff, like even in the hospital and stuff, where they already know how to order all this stuff at the hospital and stuff, and they get their little jars of honey that the cafeteria send up, or they'll get their family to come in with some. And I didn't see them just take it and scoop it and put it in there and take the cough medicine. Tell me, nurse, I need some cough medicine, and stuff. So it's a either or and stuff. But yes, it does definitely work and stuff. Thank you guys, y'all coming up with some good points and stuff, and some good testimonials and stuff. We appreciate everyone and stuff. So with TB, night sweats. It ain't just menopause or mental pause. It's night sweats and everything. Weight loss. And it's gonna be extreme. You'll see it. You drop. You drop. Where is you on a diet? Why you so skinny now? Or something like that and stuff. It's something that you see also. And then that chronic cough. And this is for TB, but it's also for COPD and stuff like that. So either way and stuff, that's some of the main symptoms that you'll see. They're telling, that's called snitching. A constant cough. You ain't when since you just always had a cough, and stuff like that. If you start coughing, you should probably take heed of that and notice that and go tell on it, because it's telling on you by coughing. It's like if you don't go get me checked, I'm gonna check you. I'm gonna take care of you if you don't take care of me and stuff. So that's where that comes in. And then there's, last but not least, bronchitis, lung inflammation, bronchitis and stuff. Hacking cough. Now I'm being sarcastic a little bit, but it's a hacking cough. It's like, ooh, it must be rough in there. You hear somebody cough like that, like, dang. If you don't tell, I'm gonna tell on some. I'm gonna tell. If you at work doing that, I'm gonna tell on you and stuff. But anyway, that hacking cough, that sore chest and sore throat, because it's a hacking cough, so it's gonna make it sore in there in that area and stuff. And then also you get a little fever and stuff. So it's something to tell on. These things aren't planned, because the one thing I will tell you is, for anything respiratory, you better go to the doctor, because you're gonna die. Like, you gotta go to the doctor. You gotta go tell on it. Anything affecting anything that got to do with you breathing in and pushing out air and stuff, you better tell on it. I'm gonna tell you that now. This is 911. This is a sidebar. 911. You gotta tell on it, because you're not gonna make it. I'm gonna tell you that now. Okay. Diagnosis type things. The things that they use to diagnosed that you got COPD, or you got bronchitis, or you got blah blah blah. Hello, nephew Romero. He said, nurse, yes, tell on it, and stuff. But the diagnosis is chest X-ray. They got a pulmonary function test. Oh, I had to do one for COVID. Oh, I messed that up. The nurse was not nursing right and stuff, because I jacked that all up. I thought I was gonna die. They plugged off my nose and had me breathing in this thing, and they told me I only could breathe out the air, but they locked it off. Oh, okay, I'm gonna leave that alone. Sputum cultures. You know what sputum is? Yo, yo. That's what sputum is, and they get it and put it. They get you to spit one of them loogies. Y'all know what a loogie is, but inside the cup, and then they take it and do some whatever it is. I don't want to know, but they take it somewhere and they find things, and then they come back and tell you and give you some medicine for it and stuff. But that's what that is. And then they got CT scans. That's how they found the COVID and told me I had ground glass appearance on my lungs, both of them. That's there forever. And I never was a smoker. I never, did that. Not to judge anybody. I'm saying that happened to me. I was never asthmatic or anything and stuff. And that happened to me. So I'm what they call asthmatic probably for the rest of my life. It's just something I got to deal with. But, okay, I'm going to leave it alone. Blood oxygen level. So that would be your O2 sat. I don't know if y'all ever seen this. They take the little ET and put it on your finger, and you can't have polish on your nails and stuff, and it looks like kind of like this. See, I told y'all I had toys and stuff, and you put it on there, and then it's supposed to light up. This one might have, oh, look, it lit up and stuff, and it got, what if it say something bad on there? I'm going to get off. Okay, it say 96%. I'm going to be like, I quit. And get off and go take care of myself and tell on it. But mine, it says 5 cent low. Okay, it say 99. Y'all didn't get the other numbers and stuff. It say 99. No, I just took a deep breath. Yes. Yes, but that's what they call an O2 set or pulse oximeter. So it gives you your heart rate, and then it also gives you the out of 100, where are you? So mine said 99. Well, I took a deep breath and it said 99. But like, if you're sick and stuff, it's going to be lower. So when you start getting down to the 90s and 91, 92, that's kind of rough. But there's also diseases that you can have, like chronic obstructive pulmonary disease, which is COPD. And then that way, theirs is chronically low. They might be in the 80s or something. So could you tell how bad that could be when you can't even pull in that good air and stuff like that? It's like suffocating, slowly suffocating, and it's bad and it's terrible, and everything. Welcome on in, Miss Kathy. I'm glad you can join. And don't worry, you can go back and watch the replay and everything and stuff. But I love that you can get on and stuff and just catch it while it's hot. And stuff like that. But always go to that replay and you'll get some good stuff from it and everything. Yes, Kathy, you said, but God. Exactly, but God. You see, I got God right where you can't even see it. Oh, wait. Yeah, God and stuff. But also, welcome on in, Auntie Barbara. You said, I'm listening. Yep, I'm trying to find those contenders for you. So let me know and stuff, when you're ready and stuff. I'll send you a little dancing man. No, she does not like me because I do that to her and stuff. If you ever seen a little man dancing, and yeah, she's gonna get me back good. She already found somebody and stuff. But okay, I still love you. It's okay. So that was some of the diagnosis tools. All right. And then we got treatments. So there's always medicine for these things that are happening and stuff, for the conditions. So asthma, there's inhalers, bronchodilators, lung dilators, like lung openers and stuff. And then there's also steroids. And that's what I said. If anybody's ever heard of prednisone or the steroid drug or whatever and stuff, that's where that comes from and stuff. And that's for asthma. And so guess what? I got props, y'all. Not even just the board, but bam. These are your puffers. You take the little thing off, and then you could squirt a little something. I don't want to squirt it in my eye. Let me see what that one do. You seen that? I ain't gonna waste all their little stuff, but yeah, they got that little stuff on there. But these help with the asthmatic person. They take the puff, one puff, and then two puffs. If you got more than one kind and stuff, and you need to take all of them and stuff, you need to rinse your mouth out because you could get mouth sores from doing it and stuff until that situation has passed, and stuff like that. So that's what those are. There's also these old fancy ones. These they're new to me also because they look a little bit different from what I've given in the hospital, but they do the same thing. They're different ones. There ain't no sense in telling you all what the medicine is and stuff. Some of you might know just by looking at it and stuff, but you take this and you pull a lever down and then you breathe it in, and it helps with your lungs and stuff. You don't want to die, so you're gonna take them and stuff. So then you got another one. Where is it? Oh, there it goes. Don't be acting like that on me. But anyway, that's another one. You pull down the lever, and then once you pull down the lever, you breathe it in and suck it in, and it gives you a life-saving medicines, and it treats and conditions your lungs and stuff. Yes. So Pastor Mayfield said they had me taking the albuterol treatments, and it started making my voice become really hard. So I don't think I can use that anymore. Yes. So you treat, this is called treating one thing and then it takes out another. So I think for those who were on earlier and stuff, I said Pastor Mayfield is actually a very good singer, accomplished singer and stuff, in the church realm and stuff like that and stuff and beyond. But I'm saying this to say that it started changing her voice, making it raspy and kind of hard and hoarse like, because she's treating one thing, her lungs, which you need your lungs to sing too, but she's treating that to take care of that condition, and it was causing another problem and stuff. So Pastor Mayfield, the recommendation is they have to find another medicine that won't do that to you, but still will help you, because if it's a choice between having your respiratory or having your voice, the ultimate thing is you got to choose your respiratory. You can't choose your voice. You got to choose the respiratory. But they do have medicines that will help that so that it doesn't take your voice away from you. That's a gift. Only God's supposed to take that away from you and stuff. So I'm saying all of that. But also, I can't sleep on this one. There's many different kinds, but as I brought out earlier and stuff, is your treatment. I bought this one literally because shame on you, Medicare and Medi-Cal and Metas, whatever and stuff. Y'all supposed to give people they asthma treatment stuff and everything, and they did not do that. They did not do that for my mother, so I bought hers, and I bought all the stuff to it and stuff. And she went on to have another asthma attack and stuff like that, and she didn't have nothing. But I fought for her stuff and got her the whole little thing. So that's what this is, a respiratory treatment that you would get at the hospital. Of course, they look different because they got to use it on you and 10 million other people and stuff like that. But also it looks different because I had to get a kid's one, but it still gives her the same dose, and everything that she needs for her as an adult. But that's what I said. You hear I said kids, meaning a kid will go through the same thing an adult is going through and have asthma attacks and everything. Could you imagine that and stuff? And that's where that comes from and stuff like that. So it's important. Yes. Oh, Pastor Mayfield said, thank you. I've been very careful. I believe that's what you said and stuff. Absolutely and stuff, because you don't want to take out your voice if you can and stuff. And there is medicines that won't take out your voice, but will give you the other things you need, and stuff, so that you keep on singing and keep on breathing. Yes. And so that was just asthma. Then there's COPD. That means that you will constantly be on that oxygen tank and everything. And Auntie Darlene, she was telling me that she suffered from that until she had a transplant and everything and stuff, but she's only breathing on that one lung. So that has to be hard for her and stuff like that. And we're going to talk on the sidebar after this and everything. But yes, that's definitely important. And then also pneumonia. We can't sleep on pneumonia. Pneumonia is the before COVID, but I think, in my opinion, it was COVID and stuff, COVID-ish, COVID like it's a cousin and stuff like that. And usually the treatment for that is antibiotics, and stuff like that. And they got even TB type medicines that you could take for pneumonia and stuff like that. So it's antibiotics and like a TB type medicine that's used to treat it. And then for TB is long-term antibiotics and stuff till you get to the good part and your chest x-ray comes out clear. And that's the only way, once you have caught TB, the actual TB and stuff, then the only way you can clear yourself and say that you're not going to pass this to somebody else is by an x-ray. And then it's a lot more into that and stuff, but I can't get into it tonight because I'm already over. And I usually go over about 15, 20 minutes and stuff, but I'm just getting to the good part. I got to give this to you and birth it, or it's going to go to waste and everything. And I don't want to do that to you and stuff. So then bronchitis and stuff. And that is for bronchitis, lung and inflammation. Rest. You got to rest up. You got to actually relax and rest. Hydration. You got to actually get those fluids in and different things and stuff like that to keep your hydration up and stuff. Not overdoing it, but just right. You need to get a certain amount of fluid in that you probably wouldn't necessarily and stuff. And then inhalers. So they got the different inhalers, like albuterol is going to be one of the main ones that you see a lot of people get and stuff like that. And so that will go for that, especially if the bronchitis kind of heals up a little bit, but then it comes right back and stuff. Then that makes it chronic. There's acute right now. It just happened today, and I ain't never had no bronchitis, or something like that, or chronic. I always get it. I always have it, and stuff like that. And you'll know the difference. Then I want to throw in some myths and versus facts. And I'm just about done. Probably about 5 more minutes and stuff. So the myths. Asthma is only a childhood disease. Well, we know that ain't true. Asthma is anybody that's a human being disease. So we know that's a lie, but it says fact. Adults can develop asthma too. They absolutely can, and it might have came from childhood and then stop for a minute and then revisit them in adulthood. So if you understand that and stuff, and then myths, we say myths versus facts. You can't exercise with no COPD. Yes, you can. You got to still move the rest of your body. That's your lungs, but you still got a little fat on the legs and flab on the arms and stuff like that. So light supervised, with cautions, and stuff, you can exercise. So that's a lie. You can exercise with COPD. It just needs to be supervised and it needs to be light, not no Iron Man or something like that where you set it off again and everything. Yes, Kathy, that's so true. Absolutely. So myth. TB is a disease of the past. Facts. TB still affects millions globally. Well, I guess it ain't a thing of the past, or they wouldn't be TB timing us, put that little juice and they're giving you a little flea bite on your arm and stuff every year and stuff. Or wherever you work and stuff, like when you're in the hospital or the healthcare setting and stuff, we got to get it every single year. So TB time test and everything, and it's a surveillance. And guess what? The kids got to get it to stay in school or to get enrolled in school. So I guess it's not gone. They talking about it's a thing of the past. Okay, myth. Pneumonia is always caused by cold weather. That might be true. Huh. That's a myth. It's caused by infections, not temperature. Well, good try. And stuff. So it's caused by infections, bacterial, like I said earlier, because I did say it, and viral infections. It ain't caused by cold weather, hot weather, medium sized weather, Luke weather, and stuff. Okay. One more myth: bronchitis always needs antibiotics. Fact. So that was a myth. Fact. Often viral antibiotics don't help if it's a viral infection. There's no antibiotics for it, even if you want it so bad and stuff. It has to be bacterial to get an antibiotic. If it's viral, it ain't gonna do nothing for you. It might help something else, maybe if you got a urinary tract infection, but it ain't helping what you trying to take it for. So it's not gonna help. But that was good, right, y'all? And stuff. So, prevention, and I'm out of here. I hope you guys got what you needed out of it. Remember to like, tag, and share, but also to watch the replay. So it doesn't matter when you came in. Go back and watch it when it queues up and it's ready to go and stuff, because this is some good stuff. And if you don't find it for you and none of this is applying to you, it may apply to your loved one, and you may save somebody by accident. But you know how you can always save somebody by accident or on purpose or whatever? If they give you they symptoms, they telling on it, but they telling the wrong person. They telling you, but then they telling the right person, because you didn't already heard my podcast. Go tell on it for them. You call the police. You tell on them and stuff. So I'm saying all of that to say that preventions: quit smoking. If you long-term smoke and you got COPD, what's the best thing to do? Quit smoking. Guess why you can't smoke? Because if you got you a little oxygen concentrator, which that's what you'll end up on, is constant oxygen, you light up and stuff, and watch who blows up. It's probably going to be you and the caregiver and all the kids around and everything else and stuff. So watch that. Avoid pollutants and allergens. Wear y'all masks. Why don't y'all wear a mask? The Asian population was been doing it for years in China, and stuff. They wear them masks. They work it out. They work it out. They live a long time. You see them, Mr. Miyagi and stuff. They be like 150 years old and stuff. Wear the mask. Okay, I'm gonna stop. Okay, and then we got get vaccinated. There's a little tricky thing to this, and I'm gonna do some deep seek research and stuff before I start really advertising everything and stuff. But guess what? I'm a registered nurse. I have to get the vaccines, whether I think they're putting poison and they're trying to purge the government and stuff like that, because I have no choice. I'm watching the people with TB. So guess what? If I don't want it and I don't want to bring it home to my family, I got to go ahead and get those vaccines. They got the flu vaccine. They got the pneumococcal vaccine. They got the TB vaccine and stuff wherever applicable. Like in other foreign countries, it's something BC or something like that. I'll get the name and put it in the comments and stuff. But they got a test for them and stuff. I mean, a vaccine for them and stuff. So they test positive for TB, but then they get a chest X-ray and they get cleared because they don't have active TB. They just took that vaccine and it stopped them from it stopped them from catching TB, where it was way more prevalent, or it was way more common in their areas and stuff. That's for people, like especially in foreign countries. And then practice good hygiene. Wash your hands. Don't be coughing into them, and then all that little hot mess be in there. And no, I'm just playing, but wash your hands. Wash your hands, please. If you sneeze in your elbow, wash your elbow, the inside and stuff, for the next time when you sneeze in there, and use it as your lubricant. and stuff. Wash in there, please, and stuff. Or you find a little package in there and stuff later on and stuff. And then you got regular checkups for early detection. Getting checked up. Let them look in your throat. Why you think they be doing that? Looking up in your nose, looking up in your ears. Remember, it's called ENT. Ears, nose, and throat. They're all related. You see what I'm saying? Yes, Kathy, tell the truth, shame the devil. Yeah, wash your hands. If you coughing it, so that's my spit. And this thing, wash it, wash it. Even me, everybody ain't gonna be perfect, but that's why you got to brush your teeth. So when you cough, it be a fresh little scent in your hand. Wash it. It still got some poison. Oh, okay. Rosetta Graniella said, "Thank you, Nurse Allen, for the great information you said tonight. Keep up the good work and information we all need it. Amen. In Jesus' name. Amen. Teach, teach, teach. Amen. Amen. I agree wholeheartedly, and I thank you for that, and I love you and stuff. Yes, she, that's my rock. That's my rock and stuff. And she be telling me and stuff, and I'm such a hothead and stuff. I don't know how she deal with me, but she does and stuff. And I'm just passionate and stuff. That is no excuse for being just weird all the time and stuff. But my head. That's what I want to say real quick and stuff before I finish. And it's just a couple last words and stuff. But you see where my head is, right? I'm gonna scoot down a little bit. You see where my head is? And I don't know if you guys remember in school a long time ago, Sonya said, "Yes, you are." Yes, I am. What? Nah. Welcome in, Sonya. But you see my head, and then you see all of this stuff around my head. That's what happens to me almost on a daily basis. It's not always respiratory, but that's what happens to me. So what I think of in my head, or what I'm imagining, that's what this is. I'm gonna ignore that and stuff. That's what this is and stuff. It's like brainstorming. That's what it is. Brainstorming and stuff. And so all of this is in here and stuff. And so I put it out there so that you guys can see what I see and stuff like that and everything and stuff. So Sonya said, "Yeah, you hot headed." I am, but pray for me. And then also, Kathy said, "Great job in the community on yesterday." Thank you, Kathy. I had the enjoyment of joining Pastor Mayfield and Sister Sonia and my daughter Brittany and I. We were on this on the block where we grew up and stuff, and it was called 6-2 Day for June 2nd. So 6-2 Day, it was a Monday, and we had a nice little barbecue and everything. And I went out to the community and I actually set up a table out there and stuff, and was doing free blood pressures and giving advice. And the thing that I thought of and stuff, which I knew it was a blessing, because the thing I thought of was instead of writing index cards and writing down 120/80 for your blood pressure, and they don't even know what that is and stuff, I wrote down their actual blood pressure after I took it. And then if somebody had a situation where their blood pressure was too high or too low or in between or something like that and stuff, what I simply did was gave them information like, you could take this to your doctor. They got this symptom. I asked them their symptoms. Are you having blurry eyes? Are you having this or that? And this is blood pressure, but I'm saying this to say that I asked several questions and stuff, and then I wrote them down. And if they had something where they were concerned, I said, "This is what you take to your doctor." I'm not the doctor, of course. I'm not even their nurse and stuff, but I said, "This is what you take to your doctor and stuff, and then you get to the better side of it." And I was able to help several people that needed, that advice, and just that in their conscience, and stuff. Because if you have it in your conscience, you're gonna do something about it and stuff. And just I saw a comment and stuff, and it's called a myth and stuff, where this beautiful young lady, her name is Sonia, she said that she's the nice one. Sonia's my sister. She said she's the nice one and I was the hot-headed one and stuff. It's actually reversed and stuff, and I'm gonna have to get her a little bit of mental health treatment and stuff, but it's okay. It's okay. I still love her the same and stuff. But yes, she's not the nice one. She's actually the mean one, and then I'm the nice one, because I give you the advice and stuff like that. She's the mean one and stuff. But we're gonna work with her and stuff like that. Everybody help me and stuff, work with her and stuff. We're gonna get her to the good side and everything. Thank you very much, miss. But you're mean and stuff. So okay. So now that I got all of that over with and stuff, I'm saying all this to shout out to Pastor Mayfield and her Joy Project and everything where she's going into the community and setting up things like this. And it just so happens that Pastor Mayfield and I have been friends for I want to say about 36, 37 years or something like that and stuff. So it's been a long time friendship, and stuff like that. That's just never went away. So we're family ship now and stuff. And with that being said and stuff, she thought of me when she thought of a nurse or doing some health aspect and stuff. She thought of me and stuff. And, I came right on in and didn't miss a beat, and stuff like that. And we were able to do that. And I was so surprised at the young adults. I'm talking about from, I want to say 21 all the way to 61, 71 and stuff, that were getting down there, sitting in those chairs, and they wanted to know the information. That's when you know that it is something that you can penetrate the system, that you can get them to tell their doctors. These doctors gonna go crazy because all these people gonna come in informed, and stuff like that. But definitely, I'm so glad of their interest. They were taking me word for word what I was saying to them. I brought information and everything. I was able to pass out flyers and different things like that to a couple people and stuff like that, and just let them know that, yeah, this is serious. And you only get one of you. Once you're gone, there's never going to be another you with your personality, with your meanness or anything else and stuff. So you know what I'm saying, or your niceness and everything. Because I see a little sidebar and stuff. Miss Kathy said, "Me and Sonia, I'm praying for you." Yes, that's right, Kathy. Pray for the girl. Pray for the girl and stuff. And then Sonia said, "Thank you, Miss Kathy. Thank you, Miss Kathy. Thank you, Miss Sonia." Yes. So I thank you guys for coming on in and stuff. Y'all wonderful. I love it and stuff. This exchange is everything. And now it's solidified in time because you're going to catch it on YouTube. I'm streaming on YouTube at the same time I'm doing Facebook right now and stuff. So you'll catch it on both, both stations and everything. And then I'm starting to do clips and commercials to put them on other platforms to get them to come on over at least to YouTube or either to Facebook if they have one and stuff, so that they could at least check out the information and stuff. So I don't want to keep you guys too much longer and stuff. It's already been almost an hour and 30 minutes and stuff. But I'm ending with medical talk in layman's terms with Nurse Charlene. The topic today was respiratory issues and illnesses and stuff. And so I just wanted to get to the good part. Like, I really did get down on them nose. Did y'all see that? And one got a little, oh, that's what I wanted to tell you. So this snot and stuff that's coming out the noses and stuff like that, guess what it turned into when it stops running and stuff? It turned into a big old booger and block your little up in there. So that's what that is. That phlegm and stuff like that that's inside your nose and stuff like that, it turns into a big fat booger. That's what a booger is. So if you want to get sick and stuff, you can eat your boogers because you just recycling that cold and stuff because there's bacteria in there and stuff. And so if you take it and dig in your nose, then you pop one in your mouth and stuff. Guess what the little kids do when they had the little snotty nose and it drip down into their mouth and then they suck it up? Delicious, huh? You just recycled your cold again. So for the little kids, and the big kids and stuff. Yeah, you got on down and recycled your code. Ain't that cute? Yeah, it won't kill you. But okay, so I'm gonna end it with that and everything. I thank you guys because y'all are wonderful. I really appreciate you, and it motivates me to come on each, week after week and do this and stuff. And if I help one person, help somebody else even and stuff like that, then my job is done. I'm okay and stuff. I'm gonna get whatever's coming to me and stuff. But if I helped you and that helped prolong somebody's life or get them to the better side, gave them a better quality, then what wouldn't we do? So I say, help me, help you, help yourself and your loved ones, if that makes sense. And remember, your body is a snitch. It's going to always tell on you. All this stuff. Your nose don't bleed for nothing. Your nose don't drip for nothing. You don't get boogers for nothing. Something happened, and stuff. So when I say snitch, it's not a derogatory word like that. Snitches get stitches and all of that. I don't snitch on nobody. No, your body's snitching on you. It's telling on you whether it's the popo or not and stuff like that and stuff. So you tell on your body. And so that's the whole point of that and stuff. So Kathy said, great job, Nurse Charlene. Thank you very much, Kathy, and thank you for coming on. And then you said, Kathy said, reach one, each one, reach one, teach one. Absolutely. I like that. I'm going to hang that as a tagline and stuff. Thank you, Kathy. I like that. And then Josie said, it's always good to learn. Very educational. I appreciate that, Auntie Josie and stuff. And thank you for coming on and stuff. Thank everybody that came on. Even if you just watched, you still came on and stuff. And I appreciate you. And I hope that we can all get to the good part because your body is a snitch. You better believe it. All right. So I'm signing off, y'all. Woo! Yes, take care. I send my hearts to you. Bam, bam. Yes, okay. Bye bye.